Hey everyone, welcome back. If you're out there looking at addiction treatment options, there's this whole approach, motivational interviewing, MI for short, that we got to talk about.
Joey.
And don't picture some, I don't know, stiff interview with a clipboard,
Right.
This
No,
is different.
totally different.
Okay, so
Yeah.
what is it like, how would you even describe it?
So I think sometimes traditional addiction treatment can feel a little bit like, someone's kind of dictating a plan for you, right? MI kind of flips that on its head and it says, how do we guide someone to uncover their own why for change?
Okay, I like that.
Yeah.
So less about giving answers and more about helping someone find their own reasons
Yes.
to make a change in their life. That almost sounds too good to be true. Like, how does that even work?
Well, it all starts with empathy. And so instead of, judging someone's choices, MI therapists, they really want to understand, like, where's that person coming from?
No.
It's kind of like you're walking alongside someone, not dragging them down a path they don't want to be on.
Right.
Right.
Yeah. But people struggling with addiction aren't always, the most, shall we say, receptive to change.
Right.
How does MI handle that?
That's where I think it gets really, really interesting. So MI therapists are all about what we call rolling with resistance. They recognize that arguing with someone or forcing advice is like, trying to push a river uphill.
Right.
It just doesn't work.
It just creates more resistance.
Exactly.
So do you just agree with them when they're like, "Oh, I can't quit because..."
It's not about agreeing, but it is about acknowledging and exploring that resistance.
Okay.
So, for example, if someone says, yeah, I'm trying to quit smoking, but, I keep lighting up. Instead of saying, you shouldn't do that, it's more like, well, it sounds like a part of you really wants to quit, but there's another part of you that's finding it tough.
Yeah.
Tell me more about that struggle.
So you're not dismissing the struggle, but you're also not letting them off the hook.
Exactly.
You're getting them to kind of articulate that for themselves.
You got it.
Yeah.
And by doing that, that actually taps into one of the fundamental principles of MI, which is discrepancy.
Okay.
So this is about gently guiding someone to recognize the gap between where they are and where they want to be.
So you're not telling them what they should do, but you're kind of holding up a mirror in a way and helping them see, oh, okay, wait a minute, there is a disconnect here.
Yeah, and you said it perfectly. It's like holding up a mirror. And here's the thing. When people start to own that discrepancy, when they see that gap between, say, their values and their actions, that's when real change becomes possible.
Interesting.
It's not about external pressure. It's about internal motivation.
Okay, I'm starting to see how this is different.
Yeah.
But I want to get down to the actual techniques.
Sure.
What are some of the things that you said toolbox? What's in the toolbox?
Yes.
What are some of the techniques they use to help people tap into that internal motivation?
Yeah, so one of them, and this is a big one, is called advice offering.
Okay.
But it's not, I think sometimes people hear that and think, oh, you're just telling people what to do. It's not that. It's much more like offering a menu of options.
Right.
So instead of saying you should really try this rehab center, it's more like saying, well, what are your thoughts on, different approaches to treatment? Some people find outpatient really helpful. Others, really benefit from a more structured inpatient setting.
Right. You're presenting choices, not directives.
Exactly.
And I would think that, if someone's out there listening to this and they're looking at different therapists, that would be something to really keep in mind, that approach of a therapist. Are they really collaborative?
Yeah, you want to look for that.
Or are they kind of, one size fits all?
Exactly.
And even just in how they describe themselves, are there any kind of key phrases that you think would indicate that they use MI?
I think looking for terms like client-centered or collaborative.
Okay.
Or, sometimes they'll use the phrase strength-based.
Okay, yeah.
Those are often good indicators that they really do kind of align with that philosophy.
Gotcha. I'm taking notes here.
Okay, good.
So we've got empathy, rolling with resistance, discrepancy, advice offering. What else is in the toolbox?
All right. Well, this one might sound a little counterintuitive.
Okay.
But it can be really surprisingly effective, and it's called therapeutic paradox.
Therapeutic paradox.
Yeah.
Okay, you're gonna have to break that one down for me. That sounds like some Jedi mind trick stuff.
It's not quite a Jedi mind trick.
Okay.
But it can kind of feel that way. So imagine, someone saying, Like, I really want to quit drinking, but it's just so hard.
Yeah.
A therapist using therapeutic paradox might respond with something like, maybe you're right. Maybe now isn't the right time to quit. It's clearly a very difficult thing for you.
Hold on, hold on. You're saying the therapist is agreeing with their resistance.
It may sound that way on the surface.
Yeah, a little bit.
But think about it this way. Like, when somebody tells you you're wrong,
Yeah.
how do you usually react?
Yeah.
You probably jig in.
Right. Yeah, I'm not one to back down from a good debate.
Right, exactly. And so that's kind of human nature.
Right.
And so by siding with the resistance, the therapist is actually prompting the person to argue for the other side.
Yeah.
So they might say, no, wait a minute, I do want to quit. It's just, and then they start to unpack, well, why is it so hard? What are the things that are getting in the way?
Wow, that's fascinating. So it's almost like a strategic use of reverse psychology
You could say that.
to kind of nudge them toward that internal motivation.
Exactly. And speaking of strategic, there's another technique that kind of works on this same principle that we call siding with the negative.
Okay.
Again, not about being negative, but it's more about holding up a mirror to the resistance and letting the person really see it
Right. Okay.
for what it is.
My mind is officially blown.
I love it.
This is like, it's like therapy judo.
You could say that you're using the person's
You're using their own resistance against them.
exactly, yeah. And you remember that that Columbo approach we were talking about?
Oh, yeah.
That ties into this beautifully.
The seemingly clueless but actually brilliant detective.
Exactly.
So how does that play out in MI?
So just like Columbo used these really carefully crafted questions to kind of get suspects to reveal themselves, MI therapists will do something similar to try to guide people towards their own aha moments.
Okay.
So, for example, they might say something like, you mentioned that you really want to be more present for your kids,
Yeah.
and yet you're also, really struggling with this addiction. Help me understand that.
Right. So they're not being confrontational, but they are pointing out a discrepancy and
Yeah.
letting the person kind of grapple with that.
Yeah, and because it's their own realization, it's so much more likely to stick. They're not being told what to think. They're actually discovering it for themselves.
Wow. Okay. I'm starting to see why MI is considered so effective. It's like you're like peeling back the layers of the onion
That's a great way to put it, yeah.
to get to the core of someone's motivations.
Yeah, and the research really backs this up. Studies show that MI can be surprisingly quick. Sometimes just a few sessions can spark change.
Wow.
It's also been shown to help people stay in treatment longer, which, of course, increases the chances of long-term recovery.
That's amazing.
Yeah.
But, I think it's also important to acknowledge, like, no approach is perfect for everyone.
Right.
Are there situations where MI might not be the best fit?
Yeah, that's a great question. And you're right, it's not a magic bullet. And so while it can be really, really effective for people who are ambivalent about change, those who are kind of caught in two minds, they want to change, but they're also hesitant.
Right.
It may not be the best fit for everyone.
Right.
So, for example, if someone is completely resistant to change
Right.
or, is dealing with severe co-occurring disorders, other approaches might be more appropriate.
That makes sense. It's kind of like you wouldn't use a screwdriver when you need a hammer.
Exactly.
You got to have the right tool for the job.
Right.
Speaking of different tools, the source material mentions something called the stages of change.
Ah, yes.
What are those, and how do they relate to MI?
Yeah, the stages of change model, I think that's a really, really helpful framework for understanding how people change.
Okay.
And it recognizes that change is rarely this sudden event. It's more like a process with distinct stages. And MI therapists are really adept at meeting people wherever they are in that process.
Okay, so walk me through, like, what are the different stages?
All right, so the first stage is pre-contemplation.
Okay.
And this is where someone might not even recognize that they have a problem, let alone have any desire to change.
Right, so they might be in denial, or maybe, like, the negative consequences haven't really hit them hard enough yet.
Yeah, exactly. Then comes contemplation. And this is where the person is like, okay, yeah, there's an issue, but I'm not quite ready to do anything about it yet. And they might be weighing the pros and cons. They might be feeling stuck, uncertain about what to do next.
So they're aware of the problem, but they haven't committed to, like, actually making a change.
Yes, exactly.
They're kind of like dipping their toe in the water, but they're not ready to dive in yet.
perfect analogy.
Okay.
And I think, as you're doing your research, it's important to remember that, um, some treatment centers might be better equipped to handle certain stages than others.
Right.
So if you're sensing that, you or your loved one might still be in that pre-contemplate or contemplation stage, seeking out a therapist who's skilled in MI could be really, really beneficial because they can really help navigate that uncertainty
Right,
and
yeah.
kind of gently guide the person towards a greater readiness for change.
That's really helpful advice.
Yeah.
So, what comes after contemplation?
After contemplation comes preparation.
Okay.
And this is where they're starting to think about change.
Okay.
But they might have some lingering doubts, some fears, and so they might be, researching treatment options, talking to people who've been there, or, even starting to make some small changes in their life.
So they're testing the waters a little bit, making sure that the temperature is right
Precisely.
before they jump in.
Yeah.
Got it.
And this is another really crucial stage where a skilled MI therapist can make a huge difference, helping the person address those doubts and fears, build confidence in their ability to change, and really develop a plan that feels manageable and sustainable for them.
But that makes sense. And I think it also highlights why, understanding these stages is so important, both for the person going through it, but also for their loved ones who are trying to support them. Because it's like, if you're trying to support someone who's in that pre-contemplation stage, it's like, okay, you can't really force them into action.
Exactly. You got to meet them where they are.
You got to meet them where they are.
Yeah.
So, okay, what happens after the preparation stage? So they've dipped their toe in, tested the waters, now they're ready for the next step. So what comes after preparation?
Right. So that's when we move into the action stage. This is where they're actively making changes. They might be going to therapy, attending support groups, practicing new coping skills.
Yeah.
And it's important to note that, this stage isn't always this smooth upward trajectory.
Right.
There might be some setbacks along the way.
Setbacks are just part of the process.
Exactly.
Yeah.
Like learning to ride a bike.
Yeah.
You're going to fall a few times before you kind of find your balance.
Totally.
And this is another area where MI can be so valuable because instead of viewing those setbacks as
Yeah.
failures,
Mhm.
it's really about helping people reframe them as learning opportunities.
Right.
Recognizing that change isn't linear, it's a process. There's going to be twists and turns along the way.
It's not about being perfect, it's about making progress. So what happens, once they've kind of gotten the hang of it, so to speak?
Right. Well, then they move into what we call the maintenance stage. So this is where they've, successfully integrated those changes into their life. And they're, really working to sustain their recovery over the long term.
And this is where, things like support systems and, relapse prevention strategies
Huge.
really come into play.
Absolutely. Yeah. And remember, even in that maintenance stage, it's important to stay vigilant because,
Yeah. Yeah.
relapse is always a possibility.
Yeah.
But it doesn't mean starting from scratch.
Right.
And again, MI can be really, really helpful during a relapse. Helping the person understand, okay, what might have triggered this,
Right.
and how can we, kind of get you back on track.
So it's a cycle. It's not just like a straight line.
Exactly.
And MI can provide support and guidance like at any point along that journey.
At every stage.
Yeah.
Yeah.
Absolutely.
Now, you mentioned like specific types of questions that
Yeah.
are used, and I think those are so key
They are.
to MI's effectiveness.
They're huge.
Can you just give us like a quick refresher on like what those are and why they're so impactful?
Yeah, absolutely. So we talked about, open-ended questions. So
Yeah.
for example, what are your thoughts about your drinking? Is going to encourage a much deeper reflection than
Yeah.
just like a yes or no question.
Yeah.
We talked about affirming statements.
Right.
Things like, it sounds like you're really trying hard. That can really help build confidence.
Yeah. And reinforce those positive steps.
Yeah, it shows that you're hearing them.
It's
Like
totally-
you're not just kind of, going through the motions. You're like, I see you, I hear you.
Exactly. And that really ties into the next one, which is reflective listening, right?
Yeah.
Just really demonstrating to that person that you're hearing them, you're understanding them, you're with them on this journey.
Totally.
And then finally, there's summarizing, which is, more than just recapping what was said.
Right.
It's really about kind of weaving together the threads of their story, their struggles, and really their own expressed desires for change.
It's like holding up that mirror and helping them see their own reflection and find their own way forward.
Yeah, you got it. And it's in those moments of clarity that real lasting change can happen.
That's awesome. This has been incredibly eye-opening, I think, Motivational interviewing it's such a different approach than what a lot of people might picture when they think of addiction treatment, but it's really about empowering people to make those changes for themselves.
Absolutely.
So as you're out there, doing your research, looking at different treatment options, I really encourage you to, keep MI in mind, look for therapists and programs that really align with those principles, that emphasis on collaboration, empathy, internal motivation, and remember, change is a journey. It's not a destination. So be patient with yourself, be patient with your loved ones. There are going to be bumps in the road, but with the right support and a willingness to kind of explore your own why, lasting recovery is definitely within reach.
Couldn't have said it better myself.
Well, thanks for joining us on this deep dive into motivational interviewing. We'll catch you next time.